Since the beginning of this pandemic, I've been hearing a lot of people trying to compare the COVID-19 outbreak with the influenza virus. Either they say that it's not as bad as the flu or it's no worse than the flu, and I think that is wrong, and that's justified by the data. Back in early June, a friend of mine posted a video comparing some data about death rates in the United States and in various places in the United States, and I think it's about due for an update of that data. So let's take a look. This graph is data that's posted weekly from the Centers for Disease Control in the United States showing deaths due to all causes in the US. And what we can see on this graph is quite interesting. So deaths due to cancer and heart disease and things like this don't really have any kind of seasonality to it. But what we can see is that the total number of deaths do follow this sort of pattern of rise and fall from year to year, and this is data over about 4-year period. And what we see is that these seasonal changes reflect the influenza virus. And the CDC calculates what would be expected number of deaths in a normal year, and that's graphed on this orange line here. And anything that exceeds that is considered excess deaths. And we can see some very interesting telling things here over the years and compare that to the COVID-19 virus. So if you look at this part of the chart right here in January of 2018, this shows some deaths in excess of what would be an expected normal number of deaths in the United States. And that is due to what was one of the worst flu outbreaks in nearly 40 years. And that was the 2017-2018 influenza epidemic. And so you can see that there was definitely an increase in deaths due to the flu that year as compared to average seasonality. If we compare that to the COVID-19 outbreak of this year, we can see that those deaths have far exceeded that even of the worst flu year we've had in nearly 50 years. So I think this is really indicative of the fact that the COVID-19 virus is not the same. I should point out that this data is not complete yet. These numbers from the CDC reflect the dates that they've received the death certificates, and those death certificates are sometimes delayed even up to 8 weeks. And so as more information gets filled in here, this actually will end up being a little bit worse. Now, these numbers are total deaths, and again, this removes any kind of comparison. This is total deaths due to all causes in the US. And clearly, there's an excess number of deaths that is unusual based on the normal periods of mortality in the United States. And this spike here in April is obviously due to some of the states that were hit early. And if you take a look at some of those states individually, we can see here, like Louisiana, here's the 2018 influenza, and here is the COVID. They had a spike early on. Michigan had a significant spike in COVID deaths, and so we can see that reflected in overall deaths in excess of normal for this spring. Massachusetts was another one early hit. You can see a stark comparison from the 2018 influenza epidemic to the pandemic today. And of course, New York was hit particularly hard, and we know that those deaths were mostly occurring in New York City, where you can see a clear change in normal deaths in New York City, and comparing to the worst outbreak of the flu in 2018 versus the COVID-19 pandemic. Now, that data demonstrates the early hard-hit states that saw a lot of deaths up front. But what's happening now? We're now towards the end of July, and what we're seeing now is that some of this COVID spread that's happening across the southern part of the United States is showing up in the death rates now. So we can see here, for example, and New Jersey, one of the early hit states, compared to the 2018 influenza to today's COVID pandemic. Well, what's happening now? We're now towards the end of July, and we're now seeing a resurgence of this virus occurring across the southern part of the United States. And it's important to take a look at what's happening to the excess deaths due to all causes in those states currently, because that's an indicator of what might be coming in the future. And if we take a look at Texas, for example, here is the 2018 influenza pandemic compared to the COVID-19, which is what these excess deaths are likely due to. And you can see they're starting to see a rise. And again, these are delayed up to 8 weeks based on those death certificates being filed. And it doesn't matter whether those deaths were due to cancer, heart disease, other diseases, or COVID-19. We see an excess of what is the normal seasonality for overall deaths in Texas. Here is South Carolina. We also see a rise starting in South Carolina. We see a rise starting in Mississippi for those excess deaths. And in particular, we see a rise, pretty stark rise here in Arizona. And I suspect some of these other states that we're seeing, Florida, California, where we're seeing large amounts of COVID-19 cases being reported, that we're going to start to see these excess deaths rising there as well. So clearly, this is not the flu. There's a significant higher death rate than the flu. And I should point out that the data from the 2017-2018 influenza epidemic is deaths even when the country was completely wide open. People were flying on airplanes, people were hanging out at bars, stores were open, there was no protections, no mask wearing, and these excess deaths that are happening now are happening even in spite of drastic measures to cover our faces and shut down gathering places and do social distancing. And so that reflects, I think, some of the differences in the contagious aspects of this virus as well. So this is not the flu. This is definitely worse than the flu. And I think the amount of deaths that we're seeing and the amount of excess deaths over normal is clearly indicative of that fact.